together a little bit more on this, and I definitely agreed with him on that standpoint. And then the governor came out with some changes in strategies and stratification of risk within the state, which I think actually are a definite upgrade. And more than anything, really what I wanted to do is just kind of sit down and have sort of an informal session to sort of go over what changes he has made and some modifications that we're going to do a little bit differently that have been agreed upon by the health officers in District 3, which are basically the counties in Northeast Indiana. So obviously we've seen a huge spike, and I printed this off, and most of you will probably learn rather quickly that I am not a technology savvy individual. So with my finger tracing, I drew a line here at September 26th, and I wrote a 5 above that. That is when we went to stage 5. Okay, and we see, boom, we jumped up. Okay, the problem with stage 5 was that it may have just come at the wrong time, but I think more than anything, people took it as we're free and open to do whatever we want, and they ignored the existing mask mandate. And so the ignoring of the mask mandate, the advancement of activities and crowd sizes, combined with the timing of the year, is that a little bit better, a little less feedback?
I can switch you if you'd like to use the mic.
Oh, this is all right. Fits my hand better. So also with the change in weather patterns, where we're forcing things inside, has resulted in what we're seeing as an exponential growth in this. So to kind of go over, I mean, I emailed everyone the new changes going from the blue, the yellow, the orange, and the red based on our scoring, or what the state uses as county metrics. And so it's based on cases per 100,000 and then total positivity rates. Right now, everybody in the state is red as far as cases per 100,000. The only reason we are still at orange is our percent positivity rate is still below the threshold to push us to red. That will change within the next week. Okay, so right now we are sitting at orange barely. There are some handouts there, maybe some of you picked them up. Almost everybody around us is red. By the grace of God, we have not gotten there yet, but it's just a matter of time. So what that means is crowd sizes become limited. Okay, if we were sitting at blue, which hopefully someday we will again, crowd sizes would be limited at 250. Anything above that would need permission from the health department for any events and gatherings. If we're at yellow, we need limitations of 100. Orange is 50, and red is 25. And that means pretty much everything. The exclusion to that becomes high school K through 12 sporting events where they can run at 25% capacity, but even that drops down to limited participation of fans if we go to red. So at red, we're essentially coaches, personnel, and parents. And that's probably where we're going to be at next week. The state is making some defining changes for the IHSA state football finals. So hopefully South Adams can get there, represent our county, and some of the fans can get to go to that game. The main difference, so let me take a step back. The health officers in District 3 have been meeting and going over what changes were coming and where we're at and strategies to try to get, I say, better cooperation or improvement in our metrics and our dynamics of how we're handling this. And we agreed upon some slight modifications to what the governor put out. They're very slight, but I wanted to make sure everybody understands what they are. Matt Sutter, Allen County's health officer, presented them at his press conference on Monday, and I believe the others are presenting them to their communities this week as well. There are really just a few variations to that. The Governor, in his order, does not list any hard cap on crowd sizes that you can petition for. So in social gatherings at Orange, there's a maximum of 50 people. But if you want to have more than that, you can petition the health department, present a plan on how you're going to run this event, and it can be reviewed to determine whether or not that's an adequate plan to proceed with an event above that capacity. The governor's order leaves that open-ended. So while you're at 50, you could petition for a crowd size of 10,000. We decided that's really not appropriate, okay? Plus the dynamics, the difficulty in managing that would be very hard to do. For Allen County, it'd be a little bit different if somebody wanted to have a convention at the Coliseum. We're not obviously going to have that problem here. Nobody's built us a facility that big yet. But somebody might want to have a big wedding reception and come to us and say, well, why can't we have 500 people at our wedding reception? Well, we just don't think it's appropriate. You know, when you're at Orange, you've got large community-wide spread, and the risk of spread is greater than what that really should be allowed to happen at a crowd that size. So we decided that we would hard cap that. And that really does just simply make it easier on the health departments, which are understaffed and just don't have time to manage and fight these fights. So for social gatherings, if you're in Orange, we're hard capping it at 250. So if you want to have an event more than 50, you have to petition us, but don't ask for something more than 250. Okay? We're just going to toss it in the trash and tell you no. Now's not the time to have crowds that size. If we are in red, which we will be, we're capping it at 100. You're not supposed to have anything more than 25. If you want more than 25, you have to petition us, but don't ask for something more than 100. We're going to say no, and we're going to toss it in the trash. So we're just not at a point now where we can be allowing these things to happen. Because, to be honest, people just don't follow the rules. You can have the best plan in the world for an event that's above what the recommendations are. People don't follow the rules. And so it's really just simply that. The other change is self-serve. In his ordinance, if you're in red, it is recommended to have the staff serve the food in buffets and self-service. We don't like that. We don't think it should be recommended. We're requiring it. So when we're in red, buffets and self-service will go away. Staff will need to serve that. This is what every county in Northeast Indiana is doing. We wanted to be consistent, so nobody can say, well, Whitley's doing this, or Noble's doing this, or DeKalb's doing this. We want to be consistent across the board and do what we can to slow this down. Okay? The only other thing I really wanted to do was try to get some communication with you guys on ways you guys think you can help us at the health department to slow this down. I firmly believe people are tired of hearing from me, and they're tired of hearing from Holly and Nathan and Jessica and Adam, and they're tone deaf to us anymore. But you are the people they trust. You're the elected leaders that they put in these positions. They'll listen to you, and we need your help. It's that simple. We need you to talk to them, reach out to the businesses, try to convince them to mask up, to make their customers mask up. It's not going to hurt their business. I've had many a patient tell me they won't go into places because they're not making people mask up. They're afraid. So if we want to get back to yellow, and we want to get back to blue, and more functionality in this county, we've got to make these numbers better. And I'm kind of running out of ideas on how to do that. I reached out to the paper today to have them share the information, and we're going to put it on our Facebook on the CDC's recommendations for Thanksgiving. I will tell you what my family's doing. We're doing nothing. We're staying home. We are going to live to celebrate another day, okay? Small family gatherings or large family gatherings are where we're seeing a lot of this spread. The assumption that it's my cousin or my brother-in-law, we're all okay, is where we're losing this battle. We're getting together to watch football games or have dinner or play cards, and somebody's got it. You get 20 people in a room, it only takes one. And next thing you know, 18 of them have it, and it's spreading on from there. So we're trying to discourage gatherings. But there are ways to do it if you are going to, and these are the way. Nobody really likes wearing them. I haven't found anybody that does yet. But they do work, and as I said, you get used to it. We could learn a lot from our kids in our schools. I do want to say first thanks to Joel for setting this up. And I can't thank the superintendents enough for the work that they've done, the way they've helped me, and the way they've worked with me and the health department on creating a good environment for the students. And our goal from the beginning that we started talking about this last March was, we got to get these kids in school, we got to keep them there. But when I say we could learn from our students, that's the safest place to be right now, is in school. There have been no spreads in school. Kids are getting it at home or in their friend's basement. It's not spreading at school. And the reason is they wear their masks. And I'm not just saying that out of my backside. We actually have data on that. The superintendents will tell you they've not documented any contact spread within the schools, but there was a study within District 3 of 7,035 students that were quarantined because of close contacts in schools. Only 51 of them ever tested positive. That's a 0.74% spread rate in the schools. The masks are working in the schools. We need to make them work everywhere else. We need to keep our kids in school for their development, academically, socially, psychologically. They don't learn as well online, and they need to be there. And if we want to watch them wrestle and play basketball and everything else moving forward, that's where they need to be. If this gets worse, we're at a greater risk of losing winter sports than we were ever at losing fall sports. So we got to do a better job as a community, and I'm asking you guys to help spread that word and that message. Frankly, I'm tired of and maybe you guys are too, and maybe you guys don't agree with me on this, the masks don't work stories. They do. There's a number of articles out there. I would encourage everybody to read the Nature magazine article, large study on masks, how much they work. So, are they perfect? No. But they do significantly reduce your risk. So even if you're wearing it and somebody else isn't, your risk is reduced by 70%. If both parties have it on, it is much lower than that. It's in the upper 90% reduction. So we need to spread that message. These things work. So, and even the cotton ones, they don't need to be N95s all the time. These masks work. So, do any of you have any ideas on how we can coordinate together to get the community more involved in understanding and really receiving this message so we can slow this down? Yes?
So I guess my question is, what are we doing different inside the school systems that we're protecting our children so much that our community doesn't get or doesn't understand the part of?
It really simply is this, Ben. These kids are wearing a mask all the time. And, you know, we heard all summer that kids wouldn't wear masks. You'll never get them to wear masks. They just won't wear masks. The kids forget they have the masks on. I've had grandparents tell me their kid, they're watching their young kids on the days they don't have school, and the kids are sitting there watching TV with their masks on. The one grandma told me her daughter was playing on her laptop, and she had her mask on. Her granddaughter was playing, and she had her mask on, and she said, "Grandma, what time is it?" And she told her what time. She goes, "Okay, 5 minutes will be my free FaceTime," where she gets to take her mask off for a little bit to get a break. And she goes, and she took it off, sat over in the corner, took it off, rested her face for a while, and then put it back on and went back to playing. The kids don't mind. The teachers will tell you, even the elementary and the high school ones, the kids don't mind, they don't argue about it. They'll sneak out of the classroom and do this, but then they get reminded and they put it back up, and oftentimes they probably don't do it on purpose. We've all worn these, you talk enough and it'll slide down if it doesn't fit quite right. But that's the answer, Ben. The kids are wearing them.
If I can interject, if an audience member asks a question and you do not speak into the mic, if you'll repeat that question,
Yes,
because
will do.
YouTube, they're not doing
Okay, all right. So,
And they stay away from each other. They try hard when we have space, but they consciously won't do that.
yeah.
They'll move their desks. They'll stay away if they can.
I think particularly at the high school level too, because they know if they want to be able to play sports and do their extracurricular things, they'll do what they need to. They need.
With your statistics, the 7,000 kids that have been quarantined because of contact tracing, and the 51 kids that have actually, contracted COVID, and all of the things that you said, Dr. Ainsworth, as far as why the schools are the safest places, what can we do to get that information out to our communities, whether it be newspaper articles, Facebook? That's what they need to hear.
Yeah, and we have put that data on the Facebook page. We're trying to share as much information as possible with the Democrat. We just got to get people to read that. And I don't know that you can reasonably rely on everyone to look at a Facebook page or read the newspapers. So we're very much a digital, online, or TV as far as receiving our news, and the other is just simply word of mouth, and that's where I think people like us talking to people. I've taken a lot of extra time in the office just answering questions and trying to share some of that information, and I would just like some of you guys to do that as well. And maybe you are. I don't want to look like I'm casting blame or doubt or pointing fingers at everybody. I'm just trying to find ways that we can spread that information, and I'm open for any other ideas and suggestions. I mean, we've got our Facebook page. We put as much information on there as we possibly can. We've been sending stuff to Janae at the newspaper and reaching out to the Fern paper as well. And so I'm open to any other suggestions.
One issue that we've had with the health department here lately is the phone is literally ringing off the hook constantly, plus messages coming through on social media constantly, because people are going into stores, like you've said, and 10 to 15% of the people aren't wearing masks. And so there's lots of complaints and comments about that. The problem is our staff is a very small staff. There's no way they can go out and police these things, and so in fact it's taking literally all their time just to try to answer the phone calls and to get back. It's going to take the community. It's going to take the community to help to try to reinforce this, whether it be Walmart, Kroger, any of the places, restaurants, is just to reinforce to people. I had somebody in my office today that said he went through Walmart over the weekend and he told 4 or 5 different people, you need to put a mask on, as he was walking by them. He said, I did it very nicely, but I told him you need to wear a mask. And I think there's going to have to be more of the community trying to reinforce that, because the health department itself is not able to go out and police these things. And even if we could, there's not a lot of teeth in it. It's something that people need to do because it's the right thing to do.
The governor's order does not have any restrictions on churches. Face coverings are encouraged. What can we do to help church, especially in a county like as highly churched as Adams County is? How do we help churches be more responsible? Can ministerial associations be involved to try to get their members to
Be better.
responsible, I guess, yeah.
So the question for the people online is, what can we do to get our churches more involved in following the rules and the guidance? Because the governor's orders really exempt the churches to some degree. And that's a good question. You know, I think it's going to have to come a lot from some of the parishioners that do want to speak up, and continuing to reach out and try to make some connections with the pastors, and you know, maybe that is something that we need to do, is more definitively try to meet with them as well. But you know, I think again, sometimes it's almost better if it comes from the ground up. That, and like Adam was alluding to, customers in stores not being afraid to speak up and say you need to do better. And so if your churches aren't great about masking and social distancing and following the rules, please don't be afraid to speak up. Or if you have some of your constituents that have the same complaints, encourage them to speak up, or send the information to us. I mean, we'll politely reach out and just let them know that people are concerned within their own parish. But again, it's a little bit of our hands tied because of the way the governor's order is written. You know, we can encourage, but we really can't do much about it. And that's why we can't do much about wedding sizes, but we can wedding receptions, because those are not religious events. So, but again, I think so much of this, you know, it can start from up here, us saying things, but getting sort of a grassroots response within the community to get them to speak up. And I think more business owners, pastors, and that hear that from their parishioners and their customers might be better at responding to that than they are going to be from us. So.
Well, we're all aware that nearly a third of our population is the Amish. And just bouncing off Dave's comment, there are 52 bishops, and those are churches also. And I don't know, Adam, has the health department reached out to the bishops? Because that's the only person they're going to listen to.
Yes. When this all first started, we sent them.
So the question from Doug Bauman was whether or not the health department has reached out to the bishops from the Amish community.
And the answer is yes, we did. We sent them a number of different information letters explaining to them what was happening and why it was so important for them to also be wearing masks and to social distance.
And they are also fully aware of the governor's order that it exempts churches. And so they're very knowledgeable about what they can and can't do within the law and the ways they can work their way around it. So, any other questions?
So what is your suggestion for a community that is highly Amish populated, that refuse to wear the mask in restaurants, convenience stores, hardware stores, grocery stores?
It's simply this: the owners and the people that run those establishments need to enforce the mask mandate that's out there.
But they won't, because they don't want to lose business.
I know, and they don't do it for non-Amish either. So you know, it's somewhat not fair to just say, well, I was in Walmart and I saw a bunch of Amish not wearing masks when there are 100 other non-Amish not wearing masks. So, but I understand, and I hear that complaint a lot. But until we do better, I don't know that we can necessarily point our fingers at the Amish community. So, but where that starts is the owners of those establishments need to be encouraged, you know, vociferously or any other way, to say you need to have your customers and your employees wearing masks. Our hands are tied a little bit on certain establishments. We don't have the ability to fine every business that isn't adhering to those rules. We don't want to really go after and shut down restaurants and bars and grocery stores. We just don't want to be that. We would rather have community-wide involvement where everybody just steps up and does the right thing. And so this is where the grassroots movement of getting customers to say, I'm not going to come in here if you're not going to enforce the mask. And so they can hear it from us, but again, we don't have the personnel to go around to every store checking on them every day to make sure they're doing what they're supposed to be doing. We are complaint driven, but Nathan will tell you, they see him walking up the door and they all put their masks on right away. So You know, so our hands are tied to some degree. I wish we could do better, but we're not funded to be able to do that, and we don't have the staff and the personnel to do that, and that's where we just have to get the message out, I think, to really make this a peer pressure situation within the community. But I am open to other ideas. I mean, and that's really why I've got you guys here is, do you have other ideas or suggestions? Because I know Adam and I and Jessica and Holly and Nathan would love to hear it because, well, we're tired of the phone calls. So.
I know we're a little ways away from this and just starting to get into the edge of discussion on the news, but has our region had any discussion yet at all how we're going to handle the vaccine when it does become available?
Those plans have been initiated with the state. The first phase that I understand, and Scott Smith can probably assist me on this, 1A, oh, I'm sorry. The question is vaccine distribution in the area when it's available. So phase 1A will be hospital employees and
Phase 1A is
yeah.
Phase 1A, Scott Smith, CEO for Adams Health Network. First off, I'd like to say that the hospital and Adams Health Network completely supports the health department and their efforts. We have emergency preparedness districts for a reason, and we are part of District 3. No one ever thought that that reason would be COVID-19 pandemic, but yet that structure is there for a reason. So I really think that the health commissioners in District 3 have done exactly what Dr. Box, State Health Commissioner, has asked. They have taken the problem locally, they have taken the problem to their region, and tried to share that message of what's best for our region. It's exactly the direction that they have been given. So I think that it's incumbent upon us to be their partner in this effort. So all those things that these health commissioners are doing, they're doing for Northeast Indiana. They're doing for Adams County and the other counties as well. They're not doing this for themselves. So the state has rolled out a vaccine plan statewide, coordinated by the health department, whereby they did a survey of hospitals to see which hospitals were willing to participate and able to participate in accepting the vaccine. I'm not an expert on the process, but I know enough to share. So phase 1A is for healthcare workers in the state. And so the state took a survey of all healthcare workers. They know how many healthcare workers are in each county relative to the state population. So they came up with an algorithm and a framework by which the allocation for each county will be made to a hospital in that area. So at Adams, we raised our hand and said, yes, we would be willing to accept the vaccine for phase 1A, which is for healthcare workers. And so we will be the vaccination site for both Adams and Wells counties for phase 1A healthcare workers. The state has an ethics group as part of that vaccine planning, where they have given priority to certain categories of healthcare workers. So long-term care employees, long-term nursing home employees are at the very top of that list as the first priority to get the vaccine. Others follow thereafter, including nurses and paramedics, EMS personnel. So we will receive direction from the state as to who is eligible for that vaccine in which order. Vaccine will not be mandatory. Vaccine is voluntary, but it will be offered to healthcare workers first as part 1A. And then it goes on from there, 1B, and then phase 2 as you progress. So that will happen over weeks to months, but the plan for that has been changing daily, if not hourly, at some point. So
I will email the slide presentation from the most recent vaccine presentation from the state to everybody. So I'll try to get that out in the next day or two. You guys can kind of peruse through it and But don't get locked in on it. Like Scott said, it may change tomorrow or later tonight. So I hope that answered your question. You know, we're still kind of in the early phase, and the timeline on that too is still really up in the air. So, any other questions?
Are you able to identify any hot spots in the county that's more than others?
Not really. Pam Pontonis, an epidemiologist at the state, we've been in contact with her rather routinely for a while now, since probably early August, and we're just seeing it's just a diffuse community-wide spread. We can't really pinpoint it back. There were a few things over the last few months where you can go, okay, well that all started from here, but really within the last month, it's just so diffuse. We can't really identify that this occurred here. It's just spread out. You know, it's just community-wide spread. It's not event-driven. So, which makes it harder. It makes it harder. You know, the big challenge with this is there are just a lot of people that aren't really symptomatic with it. Up to 30 to 40% may not have any symptoms at all. A large percentage will have very mild symptoms, and I'm sure most healthcare providers will tell you, we hear this all the time, well, I thought it was just a cold, or I thought it was just my allergies, or I thought it was, I'd just been raking leaves in the dust, that's all I thought it was. And unfortunately, we're at a time in our lives, in our history, where we just can't assume anything like that. If you have symptoms, even if you don't feel well, you thought you just ate something that didn't sit right, stay home. There's a lot of our patients that are presenting with only GI symptoms. They have no respiratory symptoms at all. Their stomach's upset. They got some diarrhea and some nausea. I would assume that's just the burrito, but don't. Particularly if it's lingering. And if you do feel that way, we just need people to stay home. And that's hard to do, We've never had a pandemic before. We're all used to kind of going out if we got a little bit of a headache and some sniffles or a little bit of some nausea or upset stomach, we're gonna go watch the game, but we just can't do that anymore. And that's kind of the message we had to get out, but people have to be receptive to that message as well. And we'll keep working at it, we'll keep trying, but you guys could really help us out, and maybe you are. I don't mean to say you're not. I'm just going to continue to beg and plead that we could use as much help as we can get, because we can't be everywhere, and I know you guys can't either. But like I said, I think they're tired of hearing from me, and they like you guys a lot more. So maybe they'll listen. So.
Should we be allowing employees to stay home and work remote if possible, or do we wait?
I really think at this point, Doug, the question was, should we be allow employees to stay home and work remotely? I think any personnel that can do their job effectively at home should be allowed to stay at home and work. I just think we're at that, where the caseloads are at. We did it in the spring and it worked reasonably well, and we didn't have nearly the caseload we do now. The more we can separate people and keep them apart, the easier it will be. And so any position that can work independently at home, I would encourage that to be done.
Even if we have went through the cost of installing glass and masks and all the protections in the offices since March, is that still needed?
Well, not necessarily. It's not necessarily needed. I would encourage it. We're not really going to enforce you to send your employees home. But even with all those protections up, there's still that risk they're going to go to the break room, or they're going to come around and talk to somebody, and they're going to do normal human nature of breaking down that barrier that's there. And if they're at home, they can't do that. So, but we're not going to come and force. I'm just going to encourage it. We're not going to mandate it. We're not going to do that. We're just going to suggest, hey, if you want to keep your people working, it might be better if they could work remotely. And then they'd be more efficient and be able to get the work done. They may still have to come in from time to time. I don't want to pretend like I know what everybody's business is or how their business is run or what makes them more efficient, but the more that people aren't gathering together, the easier it's going to be to slow this down. And you might want to strongly consider it, particularly after Thanksgiving, you know, in the next coming weeks, because next week may be a hot spot, just the day itself. So, you know, back in March, we talked about, when we were first seeing some cases, we had talked initially about after spring break, just keeping the kids home from school for a week, because we knew they were going to be out going someplace. We didn't know what they were going to bring back. It was decided then, you know, they were just, everything got shut down and they didn't come back anyway. But I think a strong consideration for at least the week after Thanksgiving, getting as many people to work remotely as possible, I think would be really an ideal thing to consider. It would allow them some time to, if they're going to incubate at home, instead of incubating in your office where they may take out 5 other employees and you're really down. So, so consider that, or spread the word, talk to some people about that. We'll put out some information on that. I really think that would be a beneficial thing for the coming time.
Dr. Answer, Tony Mellencamp, a business owner out of Bern, is on Zoom. He'd like to ask you a question. So Tony, go ahead.
Can you hear me?
Yep.
Okay. Business owner and county council. Actually, I'm curious, Dr. Ainsworth, is fever still the main identifier for COVID, or has that changed? We do have a handheld thermometer that we use, so is that still the main identifier for COVID, or are there other symptoms that fever isn't the main thing?
So fever is the number one. It would be the first concerning finding. Cough, chest tightness, shortness of breath, loss of sense of smell or taste. And so obviously anybody has any of those, even if they have 2 of those, certainly if they have loss of sense of smell or taste, our red light flags up and we just make the assumption that that's what they've got. So yes, screening for fever is ideal, but I don't also want to get into the false sense of security that if they don't have a fever, they're okay. And so, you know, just the simplicity of if you don't feel well, stay home, see what happens, see if things progress. I know that can be difficult. You know, we're in a season in which a lot of things spread around. There are a lot of viral bugs, and a lot of people cannot feel well for things that are not necessarily COVID, but by large margin, coronavirus is the most common viral pathogen going around right now. And so first presumption is that's what it is, and we can prove it's not later. And so, but yeah, fever would be the first one, obviously. Cough, chest tightness, shortness of breath, loss of sense of smell or taste. But, you know, like I said, the nausea, the diarrhea are also other findings as well.
Okay, thank you. I appreciate that. We do have a sign-up sheet for all employees at our business that they have to sign that they are not experiencing any symptoms, that they haven't come in contact with, basically the same thing that the long-term care facilities use, just as a safety measure. And if they can't sign that, we send them home. So, you know, that may be something that other businesses might want to institute as well. Just a thought.
No, I think that's a good idea, and the key to that is I think the employees have to feel like they won't be punished if they're being honest about their symptoms. And I'm not here to suggest that anybody here or anybody at any business is going to punish anybody, but I think there are a lot of people that will not report their symptoms out of fear of losing their job, not getting paid, being sent home for 2 weeks. And I think that is a challenge that we have most definitely at really at all levels. I think since we're in a school, I'm sure there are probably some students and some athletes that are going to hide any symptoms that they've got because they don't want to miss the game. They don't want to be quarantined at home for 2 weeks. And I think there are going to be a lot of people that are be going to work hiding symptoms because, one, they don't want to be chastised about it. They're embarrassed about admitting that they've got coronavirus, and they just don't want to miss work. So, Stan.
Thank you. I appreciate that, and I want to take this opportunity to thank you and the health department for all that you have to go through during all of this, because I know it isn't easy. Businesses are also going through some of that as well, because we run the gamut of, we won't come in if you enforce the mask mandate, we won't come in if you do enforce the mask. We get it either way, so we kind of understand a little bit of what you're going through, and we certainly appreciate all the efforts that you and your team provide to the county. Thank you.
Thank you, Tony.
Do we have any rapid testing available in the county?
We have a small amount that is available. It's used primarily, I don't want to say for emergency purposes in the hospital, but for patients that have to undergo procedures or surgeries or being admitted to the floor so we can more rapidly identify their status. We are working always continuously to try to improve that. Testing is always the key to this. There are some places in Fort Wayne that you can sign up to go get a rapid test and get the result in a couple hours. Scott may be able to speak a little bit more on ways of improving our testing capacity.
Yeah, the hospital is, you can all hear me. The hospital is staffing are they able to hear online? Hospital is staffing, coordinating the testing site that is the state run for the local health department, and the state has had this same question posed to them multiple times, so they are rolling out a plan to have more rapid tests at those state free testing clinics. So it's been kind of a gradual process to determine who are the most useful members of the community to use those rapid tests for, because there has been a limited supply nationwide. So again, like the guidance on the vaccines, we're getting guidance on should we be using those on the most symptomatic patients or the patients who might need to be admitted, and then is that current availability of testing, is it as accurate as the testing that you do at the hospital? The testing clinic has seen record numbers over the past week. So they tested over 900 people in the past 7 days. That's by far the most since it's been open. And I think it calls attention to the fact that there is a lot of community spread of the virus. And those tests are all run by the state. So the clinic is just for the swabbing. But yes, to answer your question, Stan, they are trying to distribute those rapid tests statewide so that people can get them free of charge like they can the send-out test now.
Dr. Smith, would you mind, since you're up there, just explaining the testing site that we have? I know there have been a couple questions this week to the health department again about where's the testing site and how does that work so that people know maybe how to get
Sure. It's the office on High Street. I think that's 805?
I think 815.
815 High Street, the physician's office building, and they are open Monday through Friday from 5 to 8 p.m., Saturday and Sunday from 10 to 2. If you call the 800 number for the hospital, for the doctor's office clinics, you actually can talk to someone on the phone who will help you schedule an appointment. I believe that number is I'll get it and I'll come back up and tell you. Or if you go to the state's coronavirus website and click on testing clinics and click Adams County, that testing clinic comes up. I tried it today. You can click on the testing site and schedule an appointment for testing. They also take walk-up test, so you can just show up at the clinic at those hours and get tested. But if you schedule an appointment, it is quicker when you're there. So you can schedule an appointment 2 ways, either the state website or by calling the office number, and I'll look that up and tell you in just a second. Yep.
As a side note to the testing, if somebody tells you it wasn't that bad, the test probably wasn't done properly, okay? And in all seriousness, if they're just swabbing inside the nostril, it's not an adequate test, and they didn't get a good test done. And some people running tests just are afraid they're going to hurt somebody, but it should be a little bit uncomfortable because it needs to go in the back of the nasal passage, not the front. So, so if somebody says, hey, my test was negative, it really wasn't as bad as I heard it would be, they probably didn't get an accurate test. So maybe encourage them to go back. So, right.
Brent Lehman, Superintendent North Adams, for anybody watching that doesn't know that. I want to go back and answer Ben's question, because he said, how are the schools doing it? I do want to also thank Dr. Ainsworth. I still remember vividly Saturday morning, March 14th, you and I talking at 8 o'clock in the morning, and I said, Mike, I think we got to pull the plug. Well, I don't think we're going to be in school Monday. And we weren't, and here it is, the end of November. Yeah. But back to how are schools doing it? It was hard. I hope I'm speaking for the other two superintendents. I think I am. We had expectations. You talk about the kids doing it. That doesn't mean on those first few days we didn't have some kids that didn't want to do it. But it just simply wasn't an option. That's the way it was going to be. And I know it's a little different for businesses because you say, well, those people are coming in my business to spend money. You'd also need to know that in the school business, we had some people in August that said, if we have to wear a mask, our kids are not coming. And they're still not coming. And for every one of those kids, that was at a minimum of $6,500 that the school isn't getting. I don't think all those people coming into the businesses were going to spend $6,500. And I don't want to be harsh to people, but it took hard conversations. And when people said we're not doing that, we said, then you can't come here to school. And that's the conversation we had. So that's the answer to the question Ben just raised. Now, it's a non-issue anymore. The first couple weeks of school were interesting. Back in July, when we were telling people what we were going to do, the phone rang off the hook and the email, you saw the stuff on Facebook. But now it's a non-issue for the most part. The other thing I want to say about that is you talk about things have changed, and some of us have had to take some days at home because we didn't have enough staff. But you were all students once, and this is going to surprise you. We have students going to our guidance counselors saying, do whatever you have to do to keep us in school. Don't send us home. So that's our goal. So now to answer the question, maybe communication. Yeah, I think we need to keep communicating to the general population, but I think the regular communication needs to be through the chamber lists of all the businesses, and maybe that's every day, and to the ministerial association, and maybe that's every day, because those are the people who can change this. We have a whole bunch of people in the general population that still think it's all a bunch of craziness. Well, people are all entitled to their opinion. But if I'm the person at the door of that business, because it's my business, saying you're not coming in, then I think it'll make a difference. So the answer to the question, how did schools do it? We alienated some people and we had expectations, and now that's what people abide by. So that's, I don't know, Joel and Michelle. Yeah, our custodians are amazing too. We spray our buildings every day and we hand sanitize and all of those things, but we just did it, and I'm proud of all of our buildings and all of our students. We kind of all adopted a phrase: clean in, clean out. Before you go in a room, you sanitize your hands. When you come out of a room, you sanitize your hands. all day long, and it works. So that, I don't know if that is quite the answer, but that's the answer I think is why schools are being successful.
Thank you.
I'm Dan Rickard, Mayor of Decatur. Mike and I talked the other day, and we talked about having this meeting and trying to get a unified message out. I think that's very, very important. When this all started, I took a back seat to the health experts because what I would say is my opinion. These guys know what they're doing. Scott, Mike, the health department employees, these are the people we need to listen to. I know people haven't agreed with all the decisions they've made all along, but they're making the best decision they can make, and they're the educated people that we should be listening to. I've spent the last couple weeks on some Zoom meetings with health officials from Northeast Indiana. I've seen nurses, doctors, CEOs of hospitals pleading for city and county officials across the area to do something. Their hospitals are filling up. You know, back there was a time when people were thinking, well, you know, more tests, more positive cases. That's true. But what we're seeing is hospitals filling up. That's an indicator that there's an issue, and we all need to pay attention to that. That is a major issue. The other thing I want to get across is I got calls yesterday and today that, oh, we're here that the city and county is going to close everything down. There's a big meeting going to close everything down. That's the last thing that I or Mike or anyone else wants to do. They're having this meeting, they're setting these small restrictions because they want to keep the businesses open. They want the kids in school. That's the reason they're doing it. They're not just moving to closing everything down. So people need to stop reading nonsense, stop the political bullcrap. That's not what this is about anymore. It's about making the right decisions for our community. So I'm just asking everyone to start listening to what the health experts are saying, and let's do the right thing for our community.
Thank you, Dan. Got the number?
Yeah, the number. Multiple sources confirm. The number is 1-833-724-DOCS, which is 3627. So 1-833-724-3627. If you call and ask for the testing clinic to schedule an appointment, they'll do it over the phone for you. It can save some time when you go to the
Don't expect to get to talk to me if you call that number. So I picked up a couple of good ideas, reaching out to the ministerial associations, and I think we probably need to coordinate with the chamber. Craig's here, and try to get a message out to the businesses, really what we want and what we expect and why, and what we hope from that. So so I'll be reaching out to you later this week, Craig, and see if we can't start working on a message to present, and hopefully it'll work.
Yesterday we sent out to all members of Chamber of Main Street throughout Decatur and shared with the Confirmed Chamber and Geneva Chamber the mask mandate, the signs that we received from the state, and asked everyone to post it. So I guess we can send out another reminder. Some people don't always open up all their emails as we're aware of, but we have worked on the positive side of that, Mike.
Good, appreciate that.
And we'll continue to do that if you
Yeah.
like.
Well, again, I think that's the expectation at the front door of that business. You don't put a mask on, you don't come in. I had a patient of mine tell me a couple weeks ago, he was at Menards, and he saw an Amishman wearing a mask there, because Menards, you don't come in without a mask. He said later in the day, he was at Meijer, and that same Amishman was walking around without a mask, because Meijer didn't enforce the mask mandate. So it starts at the front door. Yeah, again, we try, you know, we repeatedly send out information. You know, we started back in March with them, trying to educate them. Holly went to some homes to educate, and the schools did as well. And you know, we have a certain level that we can do that. Sometimes they're just not receptive to having us come up to the house or reach out and talk to us. Certainly there are more progressive Amish and some that aren't so progressive. The progressive seem to be a little bit more receptive to when we come to talk to them about anything. And then the others, there's immediately stonewalling and they don't want to talk to us. And so the unfortunate thing is this has come on the back steps of us dealing with them on some issues with septics and privies, and they are already not happy with us, and so that has made it difficult. But the simple answer to it is our business owners have to stop that at the front door. If they tell them, you don't come in here without a mask, they're either going to put a mask on or they're going to leave. And so, you know, it's like anybody else that walks up to that door. I mean, that's where that message has to be. And eventually, if they know that it doesn't matter where they go, they're going to have to wear a mask, they'll wear a mask. I did see an older Amish woman wearing a mask in Walmart the other day. I was a bit taken aback, but she was. And so, yeah. I think that's a pretty good idea. So Michelle asked, why can't we do a little bit of what we're doing at the schools to try to encourage people going into businesses to wear masks? And the recommendation was to maybe take some pictures of the students, and I would say at all age levels, with some signage that says, hey, we've got our mask on, we can do it, you can do it too, and put it at the businesses. And I think that's a pretty good novel idea. I kind of like that. I like that. So I think it makes it more personal within the community versus, you know, nothing wrong with the state sign, but you know, if it might be some kids you know personal in the community, you might say, all right, I'll do it for them. I'll do it for little Susie or.
And the original mask mandate in the state did not require the littles to wear masks.
Yeah.
Ours did in the county, and they were the best at it right out of the gate.
Yeah.
Even if we had our younger ones were the best ones too. And our older ones are reminding each other, if it's even down a little bit.
Yeah, I always assumed that the younger ones would just want to please everybody, and that they would be the easiest one to work with. I figured the high school kids would want to play sports and do the extracurricular activities, so they would be on top of that. I always figured the middle school kids would be a little bit harder, just because they're a harder age range anyway. But you know, as Michelle and Brent and Joel can attest to, a little bit of confrontational stuff maybe at the beginning, but once expectations were set and the kids knew that's what they had to do, they did it. So, Dan.
My question for Adam. Adam, these large stores have known about the mask mandate for a long time and failed to enforce it, have an employee at the door. How long do we give them and what are their consequences? Obviously, I'm in the job of enforcement, and I don't have any teeth in this fight. Unless a store owner tells somebody to leave to the night and they don't, and then I get there and then we can go do a criminal trespass. But it's not arrest anybody for a mask. But what do we have to do to get these businesses to put a person at the front door stopping people, because they're not?
We did contact the big stores just about that issue. I received a call from one of the largest ones from one of their council members, attorney for the store, and said that just simply that they were going to offer everybody a mask and they were going to tell everybody to wear a mask, but if they didn't wear one, they were not going to enforce it. And unfortunately, and I don't want to throw the governor under the bus, but his mandates really didn't have any teeth in them for us to have any enforcement powers.
Don't they have a food permit through this county?
Restaurants would, and some of the grocery stores. So
anybody that sells food, don't they have to have a food permit?
they would have to have a permit, yes.
Can we pull their permit?
We could start doing that, yeah.
You do that one time, I think the stores are going to start paying attention.
So
I'm Nathan. I'm with the health department, and I'm environmentalist, complaint officer, and also step-in food inspector now. And to answer your question about the food side of it, a permit holder, as an inspector, all I can do is employees only. So I have a 3-step process. It's a verbal written warning, a cease and desist, and then I can pull their food permit, but that is for employees only. And that is all complaint driven now. I require a written complaint, and I follow up with that written complaint, and I can go back at any time once that process has started to check in on that business to make sure that they are following those guidelines. As for the person that walks through that door, I have no ability to do anything for the normal citizen of the county or the state or anything that walks through that door. But as for an employee is where I have the ability to take it to that business.
We're talking about 2 different things. In the governor's order, it says the host is responsible to making sure they're in compliance of the order. That's not a food thing.
Yeah.
I'm talking the owner, if they're not compliant, what is the ramifications to that person? It sounds like it's a verbal, it's a written, it's a cease, and then it's a shutdown. Am I correct in that or not correct in that?
You are correct, but again, it's not considered an offense because the governor didn't make it an offense. I mean, that's our biggest problem that we have with this.
Also, the governor has a task force of the ATC, also has, who else is in that? We're like number 4 on that list of the governor's order. The ATC, I'm pretty sure I'm drawing a blank here. Excise is in there. And Homeland Security. Now, we have given anybody that calls in with a complaint, we give them ATC's number. And ATC had contacted, or a resident of the county yesterday contacted ATC after we gave them that number, because that is the task force for the state. They informed the county resident to contact a commissioner because the local health department has more backing, but we don't know what that backing is. The governor has not given the health department any guidance on what kind of backing we have. It's very hard for me as a health inspector or a county employee with the health department to go into these businesses and regulate these. I mean, I'm trying to do as much as I can. I've taken anywhere from 5 to 30 complaints a week and trying to deal with each one of them properly, but with what guidance? I don't have that guidance.
That's what I'm trying to clear with Adam. Adam,
Yeah.
Section 10 enforcement B.
Right.
It says, any business entities failing to comply with restrictions or other public health requirements for businesses set forth in this executive order is recommended the following incremental steps to be taken. Issue a verbal order. Business doesn't comply, they get a written. Doesn't comply, get a cease and desist. After that, they get shut down. This is the power to do that, isn't it? Or am I wrong?
It is. I wish you didn't say words like recommend.
Yeah.
I wish you would say shall all the way through in these orders. It would make it a lot easier for us to go through than do that. I'm going to ask you, and I don't mean to put you on the spot, but if we start doing this, will your officers assist?
With a court order, yes.
Okay, so now you're taking another step, because on the court order, we're going to have to get a lot more people involved.
But, I mean, to do a shutdown, a cease and desist, that's court orders.
Right.
And it might take us one time to do it. But it's been months, and they're not doing it. And I don't think more signs and stuff are going to tell you. You had the council for the big box store say, we're just not going to.
That's right.
So let's test it. If we want this to get better, we need to put up or shut up. Because they get called, we get called, and I have no teeth in it. The governor's order took that away. The best I can do is if someone doesn't leave when they're told to by the governor, I can do a criminal trespass. And I know they said, well, they're going to be confrontational. I don't know that because they've never told anybody not to come in. So I don't know what else to do.
Well, I believe this order goes into effect on Sunday, the one you're reading right there.
The 48?
Yes.
Or 48?
I think it does say that this order goes into effect on these things on the 22nd, so. So I guess I hope the newspaper then can cover this and say that after the 22nd. I agree.
Adam, do you have any idea or feeling of what IOSHA is thinking about enforcement for manufacturers, retailers? They enforce health and safety standards. Have you heard anything?
I have not. I'm going to guess it's like everybody else that's in here.
Underfunded.
They're all trying to do their regular day-to-day jobs, and then they had this, ton of bricks dropped on top of them too, and so they're trying to come out from underneath it. And yes.
I just have one suggestion. Have you thought about maybe having a Safe Shoppers Club emblem or something to be in the doorways of folks that will agree to abide by these safe shopping guidelines, and that be advertised? If you went to grocery shop, here's where, if you're concerned, you may go shop. Here are the hardware stores that have agreed to comply, here or whatever, and let consumers kind of buyer beware.
I've had someone tell me they were going to actually start a Facebook page with just that. These are the stores that will enforce it. Everybody that comes in has to have a mask. I think that would be good. Or like you said, putting something on the door that says, if you don't wear a mask, you cannot come in, period.
That might be something we could coordinate with the chamber too on trying to help organize and set up.
Back to Sheriff Mangel's comment about shutting things down. What have we learned, if anything, from what's happened in Wells County and the restaurant the health department has dealt with over there? Has that been held up or still shut down? I mean,
It's my understanding they're not back open.
They ruled
Yeah, he's out.
okay, so where is the steps that they take that we can't do that and start doing like the sheriff is?
Now, their situation was different because their employees were not wearing them. It wasn't the people not coming in that were coming in. It was actually that their employees were not. And they were pretty vocal about that they weren't going to make their employees do it either. So
We have dealt with a few situations like that here and shut it down pretty quickly. We've done a few cease and desist orders.
yeah, we have done that at a couple of restaurants anyhow where, and as the sheriff has said, that message gets around and people start wearing masks, at least the employees.
I just know on the southern end of the county, the mask is a joke. There is an establishment that enforces it, and pretty much it is scary to go in any place and patronize. It is across the board. Nobody is wearing a mask, employees or citizens.
One thing I can say to anybody that has seen this or done or been into a facility that has that, you can get on the local health department's website and there's a complaint form on there. Everything that I have to do has to be complaint driven and has to be a filed complaint with the county. This is for legal aspects, because if someone were to come after the health department for threatening them or doing anything, like, we have to have legal backing saying that we have a complaint form in hand. I get complaint forms every day, and I follow up on every complaint that I have. I have more phone calls than written complaints because people want to complain, but they don't want to write down what they complain about. I still try to at least contact that business to say, look, I got a phone call of this complaint. If I get it written, I'm coming. I try to make it, I try to give them the benefit of the doubt to say, look, we're watching you. Start doing what's right instead of keep doing what's wrong. One thing I'd like to tell too, if anybody that's listening, our health department is swamped with phone calls. If you have been tested and you are looking for your results, someone will contact you. Calling into the office and talking to Holly or Stacy or Teresa or Dawn, we will get hold of you at some point in time. If not, the state will get hold of you. Calling us and bothering, I mean, not to bother us, but we are taking multiple phone calls a day to where it's hard to get our other tasks done also. If you have a question on the clinic side, it's 724-5327. If you have an environmental complaint, question, or anything else, it's 724-5326. We get a lot of phone calls and we're transferring phone calls. We have actually got one of our employees right now that is home quarantined, so we're down one more person. We are taking a ton of phone calls. So, I mean, we still have environmental things to go on. I'm still trying to do food inspections. So there's really only 2 or 3 people in our whole health department that are taking phone calls in a day's time. So by calling and keep calling back and forth, we will get to you, I mean, sooner or later. So please respect the fact that we are doing as best as we can with the means that we do have. So if you have questions, you can give us a call, but be patient. We get yelled at every day. Right now, I don't think anybody in our department enjoys their job as much. It is stressful. A lot of us are taking this home with us, and we don't want to do that. So be respectful, be patient, and if you have questions, we might not be able to get to you right away, but somebody will in time. So that's really what I have to say on that, is just try to be respectful to others. We're doing as best as we can. Thank you.
Thank you, Nathan.
Mike, I've got some people texting me with some questions. They're on live. And one of them is talking about medically exempt folks that claim to be medically exempt. And if they are medically exempt, let's say they really are, what are the effects of wearing a mask that makes them scared of not putting one on?
So the question from Ben that somebody texted him was, what makes somebody medically exempt from wearing a mask, and what are the perhaps negative impacts for them for wearing a mask? I'm really a firm believer there are very, 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 I can't say very enough, few reasons that someone can't wear a mask or shouldn't wear a mask. And I'm also a firm believer if you can't wear a mask, you should just stay home. Okay, if your health is poor enough that it's a risk for you to even put on a mask, you probably shouldn't be leaving your house. So I've had patients call and want to note for work that they can't wear a mask, and you know, because they've got asthma or whatever. And my firm belief is those are the people that absolutely need to be wearing a mask, because they are at greater risk for complications if they get this. So masks are safe. Masks are not safe if you keep wearing the same dirty mask over and over again. Nobody is going to die from rebreathing air in their mask. You might get nauseated from your burrito breath, but that's your punishment alone. But you're not going to rebreathe your carbon dioxide and kill yourself. You can breathe adequately. Oxygen can move in and out, as can carbon dioxide. Where people get in trouble with masks is the disposable ones they continue to wear over and over again. They're not intended for that. Or lovely cotton masks like this one, they will wear repeatedly without washing them. You should wash your cotton masks every day, and you should throw away your disposable mask every day. So to answer the question is, there really, in my opinion, aren't any good reasons somebody shouldn't be wearing a mask. Some people may disagree with me on that, but I think very few would. If your health is so poor that you can't wear one, you should just be staying home. And the only problem you can get in with a mask is if you just keep wearing the same dirty one over and over again. So a physician sometime this summer, to prove a point, ran a marathon wearing a mask, an N95 mask, which are the heavy duty ones. And he monitored his oxygen levels and his carbon dioxide levels during the entire run, and they remained normal. You can do anything in them. They do take some time to get used to. You do get adjusted to them when you wear them consistently, and it can be done. I'm not going to tell you the first time I had to start wearing one at work that it was easy, but it's gotten easier. And so, so that when I come home and I put on a cotton mask to go to a soccer game, it's a relief. So these are pretty easy to wear. And you do get used to them. And I don't want to minimize that, but there's really no good reason not to wear one. And we just don't write notes to exempt somebody from wearing a mask. We just don't do it. So that's my answer.
You know, one of the things I think we need to remember is we're not going to be like the schools because we don't have the control in society the schools has. If we can, in my opinion, a little improvement's a huge improvement. And I think that's what we should be after.
Certainly, schools are somewhat of a controlled environment versus.
I mean, I'm not being critical of schools. My hat's off to them.
No, but I think, and I understand what you're saying, but I think we can take lessons from what they do, but part of that will be business owners buying into this idea that that it's good for their business, and that they believe the mask. And I think and I don't mean to speak for a lot of business owners, but I always try to speculate why is it that they don't want the mask. I think on two reasons. Some of them just don't believe in the masks. They just don't think they make a difference. They don't want to wear them. They don't like them. And two, they're afraid it's going to hurt their business. But I think there's a lot of data out there that shows that it may actually hurt their business by not requiring the mask, that people are afraid to go into those businesses. Even the crowd restrictions on restaurants and bars really aren't the main reasons that some of those businesses are hurting, because they're not even getting to those capacities in a lot of cities and counties. And if a bar or restaurant is set at 50% capacity, a lot of those are only even getting to 40%. It's just simply because people are afraid. They're afraid to go, period. They don't want to be around. And then certainly if masks aren't being mandated or required in those facilities, they're even more afraid to go. So if we can somehow get that message across, but again, it's convincing everybody that it's good for them to do that, both from a business and a health standpoint. You know, if somebody gets a bad outbreak in their bar or restaurant and store, they're going to be shut down for a couple weeks if they don't get sick and really have a prolonged rehab. We have certainly some patients that feel fine after 10 days or 2 weeks, and then we have some that are still feeling ill 2 months and have poor functional capacity. So it's a little bit of trying to convince people that the masks are good for them. So, Tim?
Yeah, what Mike just said reminds me a little bit of the debate a couple of years ago when bars and restaurants were looking to eliminate smoking. And you remember there was a lot of concern about whether doing that was going to hurt their business or help their business. It seems to me that overall, that's now accepted, that it's better not to have smoking in those facilities or those businesses. People accept that now. So I think this is part of what we have to try to do, is to get them to understand that by wearing masks for businesses, it's actually beneficial, not detrimental. The two other things that I would say is, if you look at our history as a nation, when we're faced with wars, natural disasters, our people have come together. We've made sacrifices for each other. I'm not a big fan of wearing a mask all day, but I will do it because I don't want to infect somebody else if I have it. And I respect that by doing that, I'm trying to protect my fellow Americans. So from our perspective, I look at it as the patriotic thing to do. And then lastly, what I would recommend when you speak with the Ministerial Association, I would encourage them to share with their congregations it's the Christian thing to do. We are called to take care of one another, to look out for one another. That fits exactly with the message that should be coming from pulpits in every church in our community. So I would encourage them to stand up for that as well.
Thank you, Tim.
From a viewer, they're recommended maybe we all reach out to our state representatives and put pressure on the governor's office. Don't know if it'll help. If you even follow Organization Day, you'll see that they're fighting over who's going to wear masks in what chamber of the government. So we have a battle here, but at least if we would reach out to our representatives, maybe we could at least understand that we're all on the same page here and we need some help.
What he's pointing out is a need to reach out to our state representatives to maybe put some pressure at the state level and the governor. I think most of us realize that there's a whole debate as to whether or not they even need to wear masks at their assemblies, which to me is just a unconscionably ridiculous discussion they're even having. So yeah, I would encourage everybody to reach out to your local representatives and try to put the screws to them a little bit.
One thing I want to remind people moving forward, as we see more businesses requiring masks, maybe asking you to sit in a certain area to keep away from other people, please be respectful to those owners, managers, employees. They are just trying to keep their business open. So just remember that. Don't argue with them. Just do whatever they ask you to do, please.
Jeff Gaskell with the Burn Witness, but I want to speak in reference to a daycare preschool that we have. So this is a question of that. I would encourage going forward that the communication is clear and has a rationale of going forward, going back in the first couple months, you know, when all of a sudden there's a text sent to Channel 21, you know, that all daycares ought to be closed in Adams County, and, you know, I've got 6 nurses and a deputy sheriff and essential workers saying, what do we do? And on one phone, I got the state saying, please don't close, you're the last domino to affect, and yet then that's what you were encouraging. So I call up the health department and say, can you explain to me the reasoning or the rationale? And they, well, we can't. And so the first couple months, there were some Facebook posts, some texts, some things going out without a clear rationale, which then makes it hard to respond. So I would encourage going forward that this is our decision and these are the reasons why, or this is what we're thinking and this is the conclusion. So I think initially there became a lot of confusion, some mistrust, because things weren't clearly communicated. And I understand that things were flying around and everybody's doing the best they can. But I would encourage going forward that there's some clear rationale to what's being asked, because I think that, at least for the first few months, creates some mistrust.
Well, I'm not gonna lie, the first few months were chaos. You know, I'm not gonna try to argue or defend anything that I've done. This has been a completely huge learning curve. I've never managed a pandemic before. So, so did I make mistakes early on? Absolutely. I'm probably still making some. And a lot of it is just, it's an overwhelming amount of things to have to juggle and manage. And there are times I forget to communicate with my personnel at the health department. And I remembered at 10 o'clock that I forgot to tell them something. So I will make mistakes, but I am open to admitting that. And if anybody has questions or complaints, let me know. Leave a number if you want to talk to me. I will call everybody back at the end of the day. I think the superintendents will tell you that. Did we make mistakes early in communication? Absolutely. Messages, information was swirling around at a clip that we were struggling to keep up with, and still trying to organize what we were doing, and so, absolutely. So.
And I was just saying, as we go forward, to make sure, you know, things, the businesses and everything, they could see the flow of thought, whether or not they agree with the conclusion, but at least it's, okay, that's, I see where they're coming from.
Yeah, and I think structurally, the organization of the information has improved dramatically over the summer and the year going on, not only from our level, but even the state level. It's much easier to be able to find information from the governor and how that feeds on down in the CDC as things have been organized and put better into place. So, Craig.
I would ask a favor, Mike, if you would, before the health department makes a statement in the newspaper, that we have an opportunity as this group of people are truly going to take a leadership role in this. You bounce it off of us before we publish it in the paper, because please understand, newspapers have editorial privilege. They write what they want to write to sell newspapers. We're truly going to be a leadership group on this. I hope that you would include us, and I think it would be great that if we would have at least a conversation or some information at least once a week. I've taken 2 things away from this meeting tonight, and I agree with Kim back here. I would like somebody to help us with some art, and we'll come we'll get some stickers, window stickers. I'll get a sponsor for it, and we'll get we'll get participation from the business owners if we'd like to do something this safe, and if they're truly going to wear a mask, we make it advertise that they are the safe place to go. I think that's a great idea. I appreciate that. And I think Main Street would back it up. I believe the other chambers would too. I also would ask the schools if we could get a hold of the art classes for the youth of these schools to draw us up pictures. The example that you said, Brent, if we can do it, you can do it, and post these on in front of these stores around the holidays. We're coming on to Black Friday, guys. We're having a county-wide shopping deal Friday and Saturday of this week. Following Friday is Black Friday. This is the biggest time for these small mom and pop stores, the one that put jerseys on kids. Okay? Those are the ones that are sticking around. We hope that they stick around. The restaurants and those people. So if I could get some help, or we as a chamber could get some help with this artwork on these two things, I'd be happy to push that, if at all possible.
And we can work on that. And I want to go back a little bit to what you said earlier about keeping you in the loop communication-wise. I didn't want to get this into a conflict thing, but until Dan came to me last week, no elected official had reached out to me any of this. Other questions, okay? We have been left on an island by ourselves, and as such have been functioning that way. That communication line goes both ways. No one's asked us, how can we help you? What can we do to make this work better? I worked well with the superintendents, Adam, Dan's been helpful, but no elected official until Dan came to me has said, what can we do to help you out? So if you want to ask me to communicate better, you need to do it as well, especially the chamber.
Well, I concur, Mike, and I didn't mean to be a threat to that. My goal was not that, but I was just thinking, now that we've had a meeting like this, can we open lines of communication?
That's why I called this. This needs to be communicated better.
And there is a sign up over here. I hope everybody has used it for your contact, your email, so that we can, if we're going to send out some things, we can just do a mass email out to everybody.
Yes.
Yeah, actually that was what I was really wanting to say kind of as a wrap. I'm not saying we're going to wrap, but this meeting I think has been outstanding because it's gotten people from all of the key leadership groups in the county, from north to south. The school systems are represented. I think the newspapers are represented. I'm hoping there's, write-ups in the newspapers about this meeting tonight and what we were trying to do as leaders in the community. So this meeting is a great first step. The emails that are on the paper over there and what you use to start this, that is what I would suggest starting with, adding people to it as we come up to, whether it be ministerial organizations, the newspapers, coming up with that good email list that anytime you have something that needs to go out, that needs to be helpful, bam, get it out to those 75 people and let us do our part to help. So I think tonight has been great, but we're nowhere close to the finish.
Oh, no. We're going to be dealing with this for another year. I hate to be blunt about it, but that's going to be the case. It's going to take at least 6 months or better once the vaccines start rolling out to get everybody vaccinated. And some will not choose to get it, which means we'll still be dealing with illness for time to come. So we've got a long road ahead of us. Anybody else?
Just so that everybody knows, the order that we have is there's copies of it on both of these tables and up here. And Dr. Ainsworth will be signing that effective today. It will go into effect, I believe, on Sunday, same time as the governor's. But even having said that, between now and Sunday, we hope there's nobody that has a big gathering of 200, 300, 400 people. I think we all realize the risks that are out there, and I know there's been some rumors of different things that are going to be going on over this weekend, and we just hope that that does not happen with the high number of COVID cases that we've got.
I really want to thank everybody for coming out. And please, my door is always open. My phone's always available. If I don't answer, I will. Leave a message. I'll call back. So don't be afraid to reach out. Thank you.